Hi, I'm Christina Bausch. I'm a physical therapist and pelvic floor specialist here at Rebound Physical Therapy. We are an outpatient clinic that is located in Topeka, Kansas. So today I want to talk to you a little bit about the two most common types of urinary incontinence and how physical therapy can help with those. So before we get too deep into that, I want to show you a little bit about the anatomy of the pelvis. So I've got a model here of the pelvis. So if you look at it, here in the front is the pubic bone. You can see the spine in the back, and then your pelvic bone's coming around. So if we look down into the bottom of that, there is a bowl of muscles that is the support from the underside of the pelvis. It's going to support all of our pelvic organs, so our bladder, bowels, and uterus, in women anyway. So when we talk about the most common types of incontinence, the first one is stress incontinence, and then the other one that we're going to talk about here in a minute is urge incontinence. And so just to kind of give you a brief description of those, stress incontinence is the type of incontinence that occurs maybe with a cough or a sneeze or with exercise or something like that. And then urge incontinence occurs when you get that strong urge to urinate and you're just not able to get to the bathroom in time before a leak occurs. To describe a little bit more about the first type I mentioned, stress incontinence, when that occurs, what is happening is that there is pressure within the abdominal cavity, so it may be from the laugh or the cough that pushes down onto the pelvic floor and onto the bladder. And so what happens is that if the pelvic floor muscles are not providing enough support from the underside, then that pressure is going to overpower the muscles and cause a leak to occur with that. So physical therapy can be really helpful, both in figuring out how to find and use those pelvic floor muscles properly. For some people, it may be an issue that the muscles are weak. For other people, it may not necessarily be a weakness of the muscles, but it may be that they're not coordinating quick enough, or maybe they're kind of locked up in this tense state and they're just not able to relax or contract to work the way that they're needed to. So we can evaluate each individual person and figure out what those sources are that are contributing to their scenario. So then to describe a little bit more about the second type that I mentioned, urge incontinence. So I mentioned that occurs when you get the urge to go and maybe you think, okay, I need to go to the bathroom, but before you're able to get there, the urine just starts to leak before you get there on time. So that's a little bit different scenario. And in order to explain that, I'm going to explain what the normal process of the bladder is. So if you can see on my picture here, so if you imagine your bladder like a little water balloon. So think about the walls of the bladder actually are a type of muscle, but they're not a muscle that's under our voluntary control. So those muscles should be staying relaxed throughout the day so that the bladder can stretch and fill and store and hold urine. So normally the bladder is going to fill part way. It's not going to be at its max capacity, but then it's going to send a little message up to our brain saying, okay, probably need to find a bathroom sometime soon. But it should go ahead and keep stretching and filling and storing and holding until you finally make it to the bathroom. Then when you sit down to go, then the walls of the bladder are going to gently contract and squeeze to help push the urine out. And the pelvic floor muscles that are supporting the bladder from the underside are going to relax to let the urine pass through. So that's what should happen. But what can happen, especially in people who are experiencing urinary frequency or urge incontinence, is that the bladder may be filling, it's not at its full capacity, but it decides, okay, I don't want to fill anymore. And so it goes ahead and starts contracting and squeezing and giving you that urge that I really need to go, I need to go. And if it contracts strong enough, then those muscles will just squeeze and overpower those pelvic floor muscles and cause a leak before you're able to make it to the bathroom. So the way that we go about treating that is by using techniques that help to calm those bladder contractions. So the bladder wall itself is controlled by what's called the autonomic nervous system. So that is the type of nerves in our body that just control those automatic processes like our breathing, our heart rate, our blood pressure, all those things that just happen automatically without us having to think about it. And so those nerves also control the bladder. So there are strategies that we can use, such as diaphragmatic breathing and calming techniques that will help to calm that autonomic nervous system, that we can use to help calm those bladder contractions and get the message to it to, okay, go ahead and keep storing, keep filling, don't start those squeezes or those contractions yet. There also is feedback from the pelvic floor muscles back to the bladder. So when you do engage those pelvic floor muscles properly, which is something that we can teach you how to do in physical therapy, that will also send some feedback back to the bladder, telling it to relax, keep on storing, and keep on filling. So common things that happen, sometimes people go into a little bit of a panic of, oh no, I've got to go, or you try to contract really strongly, but maybe you start holding your breath or tense all of your muscles, and so that really isn't effective. So if we can isolate those muscles and teach you how to use those strategies, that will help to be able to delay that urge until you can make it to the bathroom in time. So that gives you a little bit of information anyway. And of course, every scenario is different. A lot of times there may be underlying issues with the muscles that maybe there's extra tension in the muscles, or maybe they aren't coordinating correctly, that we can really pinpoint and work on a case-to-case basis. So if you are experiencing any urinary incontinence issues, I really encourage you to give us a call. We're happy to sit down and have a conversation with you, see what is specifically going on in your case, and we can put together a treatment plan to help you reach your goals.